Angelique, very good morning to you. Our concerns about where we are with regard to sort of, should we have done more? Should the President have been a little more stricter on certain things?
Good morning, and good morning to all your viewers out there. Yeah, we are living in interesting times. We are fairly happy with the lockdown restrictions, or the level 2, regarding the time at night, the curfew. We predicted that it would be from 10 o'clock to 5 o'clock in the next morning. But however, some feel that we need a bit more stricter restrictions, especially around the weekends, because that's when people come together and socialize. That's the one thing. So we will have to look and see how, what the numbers are going to do within the next 2 to 3 weeks, and that should be something that I think one need to look at. The other thing is, we're also happy to step in the right direction of 100 people indoors, but again, indoors is our problem, and I think there we need to look at least maximum of 50 people going forward. But again, only the next 2 to 3 weeks will teach us and tell us whether this was correct or not, and whether this should be stricter. We're also concerned about transport. If you look at the current transport, taxis are the mode of transport, preferred mode. We don't have other types of transport in our country except buses. And this might be a problem, especially if the taxis are more than 50% full. Again, that is where it spreads. It's a very fast or a very contagious virus, and it only wants a few warm bodies. Yeah. That's it.
And what about schools, Angelique? I mean, what were you hoping to hear about that?
The schools at this stage, they need to adhere to the principles of, again, the masks, and open. Unfortunately, I know it's winter, but you have to open up the windows in the classrooms. We need to make sure that during breaks that the children still try to stay about 1.5 meters from each other. It's even more compulsory now as we go into this third wave than before. So the strict adherence of rules is what is going to get us through this. But people are, they are sort of reluctant. They don't want to hear it anymore. And they don't feel sick. The young people doesn't feel sick, and that makes it difficult.
And I think we have to speak about all of this in the context of the latest worrying news, especially, I mean, as if we don't have enough problems. We're also looking at us possibly running out of oxygen in this third wave. I mean, we're among, if I read correctly, 19 countries that could be most at risk of running out of oxygen as our cases surge. Where are we with that?
Well, luckily, during the second wave, at the peak of the second wave, we used around about 4.5 times more liquid oxygen than we did before. And now the capacity of liquid oxygen can go up to 8 times more. And so on liquid capacity or liquid oxygen, we have enough capacity. We think that we would be fairly safe. However, the problems still will remain with all the pipes and the connections. I know that the public sector hospitals try their utmost best to make sure that they adhere to this. Remember, in the public sector, most of the tertiary hospitals and academic hospitals will have enough of this liquid oxygen. The problem might be with the cylinder oxygen. And that was what we have seen in the previous wave was a problem. They ran out of that in their local clinics and primary care hospitals. So that needs to be addressed and make sure.
Okay, so no need to panic just yet. We shouldn't be panicking just yet that we will run out of oxygen. And in terms of just a very general question about our vaccination process, where we are now a couple of weeks bereft with glitches as well. How do we start the new week?
Well, hopefully we will get to more patients being vaccinated this coming week. We need to vaccinate around about 150,000 people a day to be able to make the numbers as been given to us by the National Department of Health. That's a mammoth task. We all know that We have a problem with enough vaccines as well. Again, the other problem now is, to have people, especially walk-ins, into facilities where there's not a good ventilation, and we are in the beginning of a third wave. It is it's a bit of a tough one. That we should have been already have been vaccinated our elderly people to prevent them, because we know that they are the people who's most likely to get into the hospital. So we are in a dilemma.
Yeah. So we need to light a fire under someone to get this going even faster. Thanks very much, Dr. Angelique Coetzee.